Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists physician assistants with employment agreement and independent contractor agreement issues. Today I'm going to talk about physician assistant call schedule and coverage requirements. So, what needs to go in the contract when it comes to call, what's normally put in the contract, and then some ways to kind of save yourself some headaches. So first, it's not uncommon for an employer to refuse to put your specific call responsibilities in the contract. I think most of them don't want to do that in case things change in the future and they don't want to be locked into what's ever in the contract. So from the employer perspective, I guess you can understand that. But from the perspective of a PA, you certainly don't want any kind of language that just allows them the unilateral ability to change your call requirements at any time. So how are some ways to fix that? Well, first, you need to identify if you're even in a specialty that requires calls. Some PAs simply have no call responsibilities. Maybe if you're in like an outpatient clinic setting, you might have to do some like triage after hours that are split amongst if they have any AHPs beyond just the PA, split amongst them. And then if that's triage, then it can maybe move on towards the physician if necessary. So first you have to identify if you have any call responsibilities at all. If you don't have call responsibilities, that should be put in the contract as well. It should state, this provider will have no call responsibilities during the term of the agreement. Now, if you do have call responsibilities, what do you want it to say? Well, one, it should be specific. So if it's the expectation is you'll take, 3 days of call per week or something like, or after hours call, then that should be in there. Or at a minimum language that says the call will be split equitably amongst the other providers. That way you don't get shafted having to take 90% of the call. That's one way of at least keeping you safe as far as not getting kind of the short end of the stick when it comes to call. Now, as far as coverage goes, meaning if there's any kind of inpatient responsibilities, that needs to be in the contract as well. Having to be on call and perhaps go into a hospital at all hours is pretty rare for a PA, to be honest. But you certainly don't want to get into that situation where they say, well, it says you have call in the contract, but there's just no specifics to save you. Also, will you get paid additionally for taking call? Now, if you're just doing outpatient after hours call, you're generally not going to get paid for that. You're an exempt employee, and it's just simply an expectation of your job responsibilities. Now, if you have to do any kind of coverage in the hospital, that's somewhere where you potentially could get paid depending upon the situation. So you need to discuss that with your employer. So really, this video, the main thing that I hope you take away from this is trying to get specific language as far as your call requirements is important and can save you a lot of headaches after the fact. And you always want language that's inserted that says, if it starts in one way, there has to be mutual agreement to make any changes to it so they don't have the unilateral ability to just give you a ton of call, without you having any say in it. Well, that's a little bit about physician assistant call schedule and coverage requirements. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, take care. Bye.